Hi everybody, this is a very general video. We've been getting some questions in from people to say they would really like to be able to bring in questions to us on some of the topics that we've covered so far in our videos, and we'd like to offer you this opportunity. The way we're going to talk a bit about this just to give you some background information, but basically what we're going to do is at the beginning of each week we are going to repost the themes that have been covered so far. So for example, in week 1 we will be reposting the videos on hope. The following week we'll be doing managing anxiety, and each week at the start of the week we will post all the links in an email and also on our Facebook page. And then our work is very much about, this is a work in progress. This is not something where we are simply delivering information to you. We've spoken about that. That's a bit of the frustration with the current crisis, as we're used to interacting with and talking to people. But this is not just about a delivery of information. This is, how is this information that we're sharing, how is it actually relevant to your life? What is working for you? What are the things that maybe aren't working? Have there been queries that have come up along the way? Are there other things that you're needing to do and would like to build on? So hopefully even just reposting the videos is about saying, this is not a one-off thing that we deliver information. This is about how we are in our everyday life, because although the topics seem to be different every week, in fact, what we realize and what I'm sure you're realizing as well is that they very much are linked with each other, the things that are covered.
Yeah. And on that, whilst the topics are all interlinked and can't really be separated and they're about everyday life, what you will find when Lisa and I come onto the video is that we are talking about the topics and the whole concepts around wellness, staying well, making use of your time and getting through. All of that is done in a co-delivered way, and that is the ethos behind all of the work that we do at the Recovery College. It's not just about the delivery of information, so we hope that you're able to get something a bit more unique from Lisa and I working together to discuss the topics, to discuss different perspectives on the topics. You know, Lisa's perspective from a lived experience side, and my perspective from a person with clinical experience and trained expertise as a mental health nurse. Neither of the two are better, than the other. The range of perspectives that we bring to the videos are really what we would do in our Recovery College courses. And like Lisa says, whilst we're not able to do that, it's important that still whatever we give out and that we talk about, that we do it together. The delivery of information would just not be enough. We believe that in keeping with the ethos of the Recovery College, that we do this together, that we present the topics together, that we discuss it together, and that we are able to challenge each other's perspectives so that you're getting a true and honest account of what we believe to be important in terms of sharing with you. Yeah.
And I think as well, like we did the topic on bereavement, and Deirdre and Dr. McCluskey came in because that's their area of speciality. It's not our area. We have experience of that in personal lives, but they were bringing that in. For example, some of the courses that we have co-produced, like the medications course with our community mental health pharmacist and the Understanding Autism course, there's some courses which require, from a professional side, expertise in that. So like even on the medications course, Aaron would say, I can't answer specific queries about specific medication things, but it's very much about bringing together expertise in a certain area as well as the lived experience of that. And together that really is what's unique about the work, is it brings that richness and hopefully makes it more relatable and relevant, to people's experiences.
Absolutely. So that's what we will continue to do. We'll continue to do this. We'll continue, both Lisa and I, to have discussions and conversations and keep things as relaxed as possible. Nothing is ever planned and rehearsed before we go on video, and that's because we keep it real. And we go through whatever comes up during a conversation. So we'll try to keep that going for you for as long as is necessary until we're able to communicate and connect with you in our classroom mode again, and we don't know when that's going to be. but also we will be inviting other people in to have discussions with us and continue to do that so that we can stay focused on the range of expertise and perspectives that is important to share for everyone's benefit.
So what we'd invite you to do is, if you want to send any queries on the email address that's sent out to you, to our team secretary Belinda, the links to the videos on the topics for the questions that we'll be taking will be posted also on our Facebook page. We will do our best to answer any questions. We don't always have all the answers, so we might not be able to answer them, but we'll be bringing the questions and have a discussion about whatever it is that you would like to ask. So please look out for that. Just engage with what's relevant to you and what works for you, and we will look forward to hearing from you.
Yeah, so thanks very much, folks.